Awesome. So my presentation's on anti-anxiety sedatives or benzodiazepine, which is a part of the anti-anxiety category. So I should obviously tell you guys what they are. So anti-anxiety sedatives are a type of drug used to calm down or help relieve symptoms of anxiety. Now it also works with depression or kids who have overactive minds. They are called downers, which we'll be talking about a little bit later because that's also a street name for them. So benzodiazepines are a form or strain of anti-anxiety sedatives. What these focus on doing is relieving the feeling of agitation, and it also creates a feeling of less anxiety. So I'm going to talk a little bit about where it all started. So there's a man called Leo Sternbach who created the drug. He was a part of the company Hoffman Roche, and he marketed it so he could have, because the drug had less dependency, so some of the other drugs you could get addicted a lot faster, and it just wasn't good for his clients. It then got branched off from that and was named Librium, which then branched off to Valium. So we don't like to use Valium so much, so they are still more focused on benzodiazepines, and they don't suggest them for older clientele as well because it messes with the hormone imbalance. So it's usually for kids ages 16 and up. So by the 1980s, things were changed and legislations were put in place in order to show the use of the drug properly. And they also put in a concern for elderly and the effects that changed compared to younger youth who used it. This was then proven to be the most popular medication in America at this time, according to research by the Center of Substance Abuse Research in America. So now I'm going to talk about how it is not a natural substance. So they are actually created in laboratories, so it's not created out of the fungus or anything like that. And they're created with chemical compounds. They are sedative drugs, so they reduce activity in certain parts of your brain, which I'm going to talk about as well, briefly about how it affects the GABA neurotransmitters in your brain. So some of the street names are as follows. They're downers, benzos, tranquilizers, and nerve pills. So these are sold on the street to get high sometimes. So this is the kind of thing you would look for. So instead of creating a hyper effect, it makes you feel numb. So you don't feel any sensation at all, you're very calm and relaxed. So what it does to your brain. So essentially we have neurotransmitters in our brain that sends electrical impulses back and forth, and they talk. So the neurotransmitter GABA, or gamma-aminobutyric acid, which is known for being the quieting transmitter, so it calms the brain. So if you don't have those signals going out, your brain jumps up and down, you get all excited, and you can't calm it down by yourself. So what benzodiazepine does is becomes GABA's buddy and sends the right signal to your brain in order for you to relax your brain and calm down. So how do you take the substance a little bit? So this substance is usually taken orally by tablets, but it can be prescribed by a doctor to get an injection. You can rid of the substance by using a drug called flumazenil. So it just counteracts the benzodiazepine, and it makes it easier for withdrawal.
Mrs. Patterson LeClaire, could you please come to the office? Mrs. Patterson LeClaire.
So some signs of people abusing the drug would be slurred speech, slow breathing, and they're less alert. Effects could be depression and anxiety, and they can be confused, short attention span, hard time understanding. Some youth could also kind of look drugged up, so they're just spaced out, which I found to be the most common when looking up the research. So some of the dangers of abuse and overdosing is they can, when using them with other alcohol or substances, it becomes a bigger problem because they react together, so they could OD a lot faster. You could also cause possible sexual aggression towards others. Overdosing can cause heart problems, trouble breathing, and increase in blood pressure. So some of the risks, if the adult or youth were pregnant, would be a cleft palate or terminating a pregnancy or abortion. So your hormones are going to be imbalanced, and it's just going to affect the fetus. It also affects the growth of it. So risks is that it could be found in breast milk. So if you're planning on becoming pregnant, the best way to avoid this is to get off the medication before you decide to have a child, because the infant can be getting it through the breast milk. There's also visual and auditory functions, so some things might be louder, or they might have blurred vision when taking the drug. So signs of dependence, so this is when they've taken it over a long period of time and they're having a hard time getting off of it. So that would include rage, depression, or physical signs such as aggression. Withdrawal would be lack of sleep, nightmares, or irritability. And it can change their mental and physical health status. So you might not always be able to see the signs of them on withdrawal. It could just be mentally in their brains. So treatment plans for addiction and anxiety sedatives. So when looking this up, I found a treatment called flumazenil, which I talked about previously, and it reverses the effects of overdosing on benzodiazepines. So my suggestion would be talking to your physician and counselor about how to get off them as well, because it's not something you can do by yourself. You need to slowly get off the medication in order for you to be able to go out in the world and not have so much withdrawal. There's also rehab clinics in Peterborough, so the one I found was on Hunter Street. So it helps you slowly get off the medication and transition back into community settings, such as school or into your own home. And here's their references. So are there any questions?